Welcome to QD Clinics on RA. I'm Jack Cush with Room Now. Today's case is RA introductions. A 46-year-old female comes to see you for a second opinion and maybe to transfer her care to you. Heard good things about you. RA was diagnosed 6 years ago. Rheumatoid factor was positive, CCP greater than 250, symmetric polyarthritis, high SED rate and CRP. The first rheumatologist she saw gave her methotrexate. That made her kind of sick with GI stuff. Gave her hydroxychloroquine. She was freaked out about the eye thing and never filled the prescription. And she was on prednisone, which only made her gain weight and develop double vision. And so she tried to get off that, couldn't get off that. Went to a second rheumatologist who put her on leflunomide, caused hair loss and diarrhea. Put her on etanercept, which worked for a while, but then she got numbness and was worried about the ads on television that said all those side effects, like, numbness. So now she's not doing well. She's has swollen joints. She has 7 tender, 4 swollen joints. She's got pain and stiffness in her hands and her knees. When you're talking to her during this 1-hour intake visit, yeah, I do 1-hour intake visits, she tells you about her anxiety, about her children, about her aunt who had horrible RA and had deforming disease and was in a bed for the last 10 years of her disease. Her parents are sick and she takes care of them and she can't because she's so sick herself. She tells you about a dinner party she went to last week where she found out she liked spiced rum and giggled about that. But clearly this woman is worried and nervous about seeing you because you're yet another doctor with a prescription pad, and she has a mistrust of medicine and of the medicine men and women that she's hoping to get help from. So my big question to you is, what do you discuss to get her back on track? What's the messaging where you're going to do her the most amount of good? And here are the choices. A, have a benefit-risk ratio discussion about the medicines you want to use. B, tell her that the more we wait, the more inflammation will run amok, cause damage and comorbidities. There's no time to waste. C, family history is overemphasized. Don't get bogged down in that. D, that she should fear her rheumatoid arthritis way more than she should fear the drugs that the doctors have used or may want to use in the future. And lastly, E, why spiced rum is a great thing and how alcohol could be beneficial. And my answer is E, spiced rum. It's goofy. It's not what she's there for. But she's not there to hear what you think about IL-6 inhibition or combination biologics or biomarkers and all, what you spent the last 10, 20, 40 years learning. She doesn't want your knowledge. She wants to know that she can trust you. She wants to know that you're going to listen to her. She wants to know that you're a doctor and not someone who's going to be a 4-star general telling her what to do. And then she's going to doubt you. It's better to get her trust. So I would have spent 10, 15 minutes talking to her about spiced rum. I know nothing about spiced rum, but I'd get as much as I could out of her about it and then make her comfortable, say a few things about alcohol not being a taboo thing in people who have arthritis. Alcohol is anti-inflammatory, as you know. And then you have her confidence. Ask her what she wants to do. So do something simple from the start while you're staging her and doing testing. Then move on. Now, you're a doctor she can trust. Tune in for more QD Clinics here this month in September. This month, which is Hard Decisions in RA, is been sponsored by BMS.